Looking back, what do you recall were your first impressions of the health board?
I think my first impression was one of the great scale of what we're doing here, not just from a building and hospital and site perspective, but actually the full range of the services that we're providing. Mental health was an area that I had a lot to learn about. I knew more about hospitals, although I had worked for a little while in community and primary care services, but I guess it was just this huge spread of things that we were doing here, and I also remember feeling slightly intimidated by the scale of the challenge, because this was an organisation that had quite a lot of improving to do, and I was very aware that that there was quite a big hill to climb.
I'm sure everybody would be very interested to hear what the challenges in Doha you'll be taking up. Can you tell us a little bit about that?
Yeah, so I'm taking on a new role. There's a hospital that's recently opened in Doha, which is the capital of Qatar, and that hospital, they're looking for someone to come and take it on and to develop it and to strengthen the way it performs, the quality of what it's offering. And I know that the Qataris are very interested in what the English and Welsh NHS systems have been doing over the last 10 or 15 years when we're looking at things like safety and the quality of what we do. And I'm hoping that lots of things that I've learned about how we improve our services, the continuous improvement methodologies, the way in which we engage with the front line to help them to understand what they can do themselves to improve the way things work. I'm hoping that many of those things will have a place in Qatar. But I'm very mindful too that, of course, I'm working in a new culture and a new environment, so I have lots to learn, which is another interesting and appealing part of the opportunity, because I think I'm a naturally curious individual, and I think it'll be fascinating to see how all of that comes together in a new setting.
It's been, say, 4 years. Has it felt like it's gone quickly, or?
Enormously quickly. I can't believe it's gone as fast as it has. I'm very conscious that the job here isn't finished by a long way. But what I would say is that I have enjoyed enormously the role. I think it's a massive privilege to have been here and have worked with all these people in this organisation, working as it does to try and do what we do every day. And I've thoroughly enjoyed it. It's been an absolute privilege.
What would you say has been your standout memory of those 4 years then?
Well, I suppose if you're looking back, you're bound to remember some of the difficult days. And I do remember there were some difficult days, not least when we were featuring prominently in some of the adverse publicity that we had to deal with. And I'm pleased to say that is happening much less frequently now, which is a good thing. I guess the other thing that also stands out, I think, is the sense that you get, and I don't know whether it's a Welsh thing, but certainly I've felt that people are really committed to the idea of the NHS. It seems to me, having been here working in this organisation, that the idea of a national health service where we are trying to do the very best we can for our population and with our communities, that feels like a really real and very close at hand idea. It's not a remote concept.
Why do you think that connection is there here in Wales?
Well, it may be that, of course, some of the founding ideas originated here in Wales, and I think that's certainly part of it. I also think that in Wales there is a sense of community that perhaps in other parts of the UK I haven't felt quite so keenly. And I guess it does matter at the end of the day. What we all try and do is to shape the healthcare services that we supply and the healthcare that we offer to our citizens to meet their needs. And I think it's it's a really strong feature of the NHS in Wales, this relationship that we have with our public, the population. It's very close at hand in Cardiff, of course, as well. All the national media locally, the Assembly are here. So you do feel that sense of being very close to what matters in terms of healthcare for the population of Wales. And I think the other piece of that is to continually emphasise the capability and capacity of our own people to fix some of the problems for themselves and to deal with some of the challenges they face. And our job really is to stand behind them, stand with them, to support people. And one of the great pleasures of every year is to go to the awards evening, where we hear so many great things about what people have been doing across the year, quite often in difficult circumstances. And to me, that's the magic. That's the real magic of what we've got, which is passionately committed people trying to do the very best that they can. And our role really to try and help and support them do that even better than before.
Mm-hmm. You've spent a lot of your time, as you said earlier, going out and visiting teams in the hospital setting, community, mental health. During those travels, who's really inspired you?
Do you know, funny enough, I was thinking about this the other day. I remember going to see some of the teams who were working in the old Whitchurch Hospital, and I have to say, in some of the most challenging environments I've ever seen, really. Very, very difficult to imagine how you can design and deliver a service in those sorts of situations. But there they were, not complaining about it, getting on with it. And not long after I arrived, actually, the older people's mental health service opened at Landock, and I was very lucky to be able to join in with the celebrations as that building opened. And I do remember really vividly, there was a sister who had been working in Whitchurch for over 40 years. And she clung on because she wanted to see this new facility open. And she wanted, at last, to be able to do the kinds of things she's always wanted to be able to do, but never quite been able to manage in that setting. And that was such a humbling moment, because there was this individual who'd given her life to service users with mental health difficulties. And here she was at long last, towards the end of her career, able to do all the things that she'd always wanted to do. It's just marvellous, absolutely brilliant.
And do you take a bit of joy in being part of that journey for her? Yeah,
I mean, I have to say I had very little to do with the design of that facility, and I think the creation of the Havanacoid facility is an absolute triumph. It's a real tribute to the people who work with service users and allow them and encourage them to be part of that design process right from the very beginning. And that whole building has a spirit and an ethos and a look and a feel which can only really be developed if we're genuinely working with service users. And I think it stands as a bit of an emblem for how we design our healthcare facilities at our best. It's a marvellous new face, I suppose, for mental health services in Cardiff.
What do you think are the challenges for Cardiff and Vale in particular in the next sort of 4 years?
Yeah, so some of the big challenges for the Health Board, I think, will be to continue to make sense of this organisation's role in relation to the provision of services that only we provide. We do have a big responsibility to make sure that those services are well resourced, that they're provided in good quality accommodation, and there are some substantial challenges on the UHW site in particular in terms of its infrastructure and its age and its suitability for modern day medical practice. And I think we've got to redevelop I know we're going to redevelop the UHW site. That is a big challenge. And at the same time, we've got to ensure that the relationship between the UHW site and the UHL site is clarified so that everyone understands their complementary roles. And of course, then above and beyond all of that, we've got to translate our strategy into a system that's much more inclined to maintain people at home or close to home. And we've made some progress. Some of those things are beginning to happen. And I'm looking forward really to seeing this organisation moving those things forward over the years to come. It'll be great to see.
Do you think it's hard to sort of shift our focus when so much attention is placed on A&E times and that kind of thing, and all those stats we have to try and hit?
Yeah, I think the system is still defined in many ways by what the hospital part of the system does, and I think that's a bit of a challenge, because that isn't the only measure, of course, of whether or not we're doing a good job. I quite like looking at some of the measures that say that we're managing to admit fewer people over the age of 65. We're admitting fewer people with long-term conditions. Our readmission rates, so failed discharges, are declining. And to me, those are really important messages, because they're telling us something important about the underlying picture. But of course, in a city where the population is growing as fast as it is here in Cardiff, it's one of our other really significant challenges is how do we accommodate and how do we shape our offer around a population that's growing as rapidly as it is in Cardiff, and therefore there always is going to be pressure in those pinch points. But I think the recipe is the same. I think if you can make sure that people have got good local services that they can access, and we're preventing rather than waiting for people to decline, that's part of the key for us in the future, I think.
Okay. You've spoken quite a few times today about how you've been able to see a lot of staff. You've probably met hundreds, if not thousands, of Cardiff and Vale staff over the years. How would you describe them?
So I think our staff, how would I describe them? I think they are amongst the best I've ever had the privilege to work alongside. I think people first of all, there are so many different kinds of people, so many different jobs, so many different roles, and everybody, of course, in the end, they're all here for one purpose, and that's to make what we do possible. Some of the food for thought lunches that I've had the privilege of meeting people who are beavering away in the deep, dark background. But they get up and come to work because it matters to them, just as much as it matters to the surgeon operating on a patient who's on a table. So I think it's that sense of mission, that sense of why we're trying to do what we're doing, that I have found so energizing, actually. And that commitment that people bring to what they do, it's truly remarkable. And it is challenging. Healthcare can be a challenging environment. It can be busy. It can feel unrelenting. It can feel like there's a never-ending nature to it. But I have to say, the people who we work alongside are amongst the best I think there are.
What would be your message to your successor?
First of all, I would say you're a very lucky person, because it is a rare privilege to be in this job. I think you've got some great people that are there for you, will work with you, and will help you to understand what needs to be done. And I think I would say to whoever it is that comes, just remind yourself that it's a privilege. And enjoy what you're doing, and I'm sure good things will happen if you do.
What one thing will stick with you, will be most proud of to leave behind?
It's hard to say. I do think that the strategy that we've developed does seem to be a strategy that people respond well to. I think we've made a serious attempt to try and describe what it is that needs to happen for this organisation to deliver on its promise. We've done that with a serious intent to engage service users, families, and our staff in developing that picture of the future. And I hope that provides a route that the organisation can follow that will allow it to do the things it needs to do to deliver on its promise, which is to care for people and keep people well. So I'd like to think that was something that I can say we achieved during the time that I was here. Okay,
and what will you miss most about Cardiff and Vale?
So I'm going to miss the people. I'm going to miss the community in which we operate. I have to say, although there have been difficult days, we've talked about those. On the whole, the people that you meet and you talk with and you listen to have only got good things to say about what we're all about. And I'm going to miss the camaraderie of those people that we work most closely with, of course. And I'm also going to miss, there are going to be some funny things I'm going to miss. I'm going to miss, my secretary. I'm going to miss people like Jane. She's been a huge part of my every working day. I think it's a very strange feeling to be leaving because I do feel very at home here, and I have really enjoyed working here.